All right, we've all got something that we're afraid of, right? Whether it's clowns, flying, spiders, some of us afraid of the dark. So this week on Fox 6, we're all facing our fears.
And today, Rob sharing his fear of needles.
Yeah. I decided what better way to tackle my fear than by getting poked with several tiny needles. Yes, acupuncture. All right, David, so obviously I'm here to kind of test my fears, but I'm probably not alone. People are a little bit afraid of the whole concept of acupuncture.
Yeah, you find that to be one of the common barriers. Most people are afraid of the needles because they're most used to hypodermic needles. They're hollow, they're thick, they're serrated, they damage tissue when they go in. Acupuncture needles are completely opposite. They're thin, they're about the width of a cat's whisker, and they're inserted practically pain-free.
They're really that thin, like a cat's whisker?
They're very thin, yes.
Well, I will take a big, deep breath and try to
Ready?
Get my fears under control here.
We'll take the socks and shoes off and get as relaxed as possible.
So normally I'd lay back, but because I have to work the microphone, I'm just going to sit up here.
Sure, fair enough. So you're experiencing a bit of pain in the shoulder right now?
Yeah, it's kind of more of a joint pain than a muscle pain.
More of a joint pain than a muscle pain, okay. And the needle is, again, completely sterile. It's used one time and then disposed of. It's used to generate circulation, yeah? Because
And now do you like slowly put this in, or is it just like a big wham?
it's quite a quick method. So we're going to insert the needle now, okay? We're going to do a little grouping of 3, just like that. The needle's in.
Get out of here.
Yeah.
I didn't feel that at all.
That's right. No fear necessary, right?
Yeah. If I wasn't watching, I wouldn't know you did anything at all.
Yeah.
Now, how long would you leave the needle in?
We typically leave it in for about 25 to 30 minutes, and we usually turn down the light, let people relax a little bit.
Right between the eyes.
Right between
Seriously,
the
right between the eyes.
Just like that.
That must be a good look. Let's do that, and then we'll just see. I mean, obviously one treatment might not cure everything.
Yeah.
I can actually already tell you that I feel an improvement in the condition, which is weird. Any excuse for a nap, too, right?
That's it.
The other issue, of course, is education. As people learn more about something, whether it's a fear of needles or a fear of acupuncture, that fear tends to be lessened, and obviously it's something you can help with.
Yeah, absolutely. I mean, a lot of people are apprehensive to get acupuncture because they don't know much about it. So we're generating a reaction through the nervous system to generate circulation.
All right.
All done. We're going to take those needles out now. Okay?
All right. Most of them I don't feel. Well, I gotta admit, there is some improvement in the shoulder. Like right now, I would say I have no pain whatsoever.
Excellent.
I think with the fear of needles, I would think it was somewhat confronted. I don't know if I would say I was overcome, but it was definitely something that I realized that having the needle under my skin for a prolonged period of time, which is my biggest problem with giving blood or having blood drawn for tests, it wasn't as big a deal as I thought, because I was aware of a couple of the needles, and as time went along, I did get that urge to like get this thing on me. But you know what? It kind of faded.
You look good walking out of there.
Yeah, it really helped my shoulder. I don't know whether it overcame the fear, but it did help. Baby steps, like the doctor said. And a big special thanks to the folks at the Acupuncture and Holistic Health Center, which is down in Bayshore.
Good. It didn't hurt, did it?
No, there was no pain with the acupuncture at all, but a couple of them, most of them you can't feel at all. You wouldn't know they were there if you didn't watch doing, which I wouldn't imagine the average patient does. But I could feel a couple of them, and the ones I was aware of, after about 5 or 10 minutes, that kind of phobia
started messing with you.
Just like, it's the same thing as when I have to have an IV or when I have a blood draw. It's just like, get it out from under my skin, get it out, get it out, get it out.
Yeah.
I give you credit.
Yeah, well, I
for you.
survived it.
All right.
Yes.
More
All right,
fears.
now.